length of stay on ITU and reducing the length of hospital stay overall. And I think that's where we need to get better at collecting more data, in all honesty, to show that. And that's something that, you know, has been hampered a bit by COVID for the sheer volume of patients coming through, but we're very focused on going forward. So yeah, thank you.
Thank you, Rachel. Thank you, everyone.
Thank you. We have a number of really helpful and supportive comments in the chat bar, which I'd like you to read. But Nicola, can you continue with your report?
Yeah, and thank you, Stephen and Rachel. We've picked up some of these different stories at the Critical Care Delivery Group, and I think it really does highlight the impact. You know, and I asked the question, you know, what do you do when you're on leave? How do we cover? Because, you know, to rely on one person is not really sustainable. But I think in terms of the broader report, which I think is a great report and really does capture the progress made on critical care, but has been a hugely challenging 18 months for the critical care teams, not only responding to the pandemic, which has a huge impact on them, but moving into a new unit. And as Steve said, merging the teams literally weeks before the peak of that second wave, you know, and adapting to that new environment. And, you know, I think it's quite humbling to read the report in terms of what the team has achieved and the positive outlook the team has got for the future in terms of development and opportunities. And I think sitting around the Wales table, I think we're in a really good position in an Iron Bevan, and we've made significant progress against the Welsh Government national priorities for critical care, you know, which includes expanding our level 3 critical care beds, which we have over the last few years, and have now got the potential and the physical space to increase by another 6, which is quite unique, because most departments are literally kind of gridlocked in their existing space. The development of post-anesthetic care units has been a key priority. We already had one in the Gwent. We've got, we'll pick up later, plans to expand, but we've managed to maintain that at the Royal Gwent, which has enabled us to do quite, you know, high acute surgery. And I think we're the only unit in the UK where we've got that not co-located to a critical care unit. So really are taking forward that model. The 24/7 critical care outreach is a key priority. We had this in place anyway, but through the funding we managed to increase the hours. We are now trying to adapt and learn to cover with our service across 4 sites, and we have the potential to make it 24/7. Workforce was a key priority for Welsh Government, and as we've said, we've invested in training and practice educators, but also to try and deliver against those GPIC standards. And that investment in therapies was seen as a key priority by the team, hence the story today. And I think it's been really good to help us evaluate the impact it can have, to help inform what we think the model could look like for the future. And there's also been a lot of work at a regional level around long-term ventilation and a regional transfer team. I wanted to draw out some of the work the team have done around patient experience, particularly the patient diaries. This has been picked up through peer reviews as quite exemplary. That focus on diaries for patients and follow-up of patients after they've left critical care is really seen as, you know, truly kind of the gold standard of how we should be supporting patients who go through, as Steve said, some of the most frightening time of their stay. And I think the team also should be commended on the work they've done around staff wellbeing. They've done a lot of work just within the team locally in terms of the support it offers, in addition to the wider wellbeing support that we offer as a health board. So the key priorities, I think the team are really clear about the priorities for 2022 and beyond. Welsh Government have highlighted critical care as a priority area as part of its the recurrent funding letter we had recently, and comes through the National Clinical Framework as well. And really kind of we've focused, as you can see in the report, there is the opportunity for us to open the extra pod, the 6 beds. The team will be putting together a business case which will be considered as part of the INTP priority process. We've got plans to increase the PACU beds, as I said, to 9. There is, as we can see, there is potential to get more benefit by increasing our therapy and allied health professional support even further to make it more sustainable and potentially get more benefit from that workforce in terms of patient outcomes and length of stay and experience. And I think the big area as well we've picked up is around follow-up rehab. We touched on it through the story, but I think, you know, we had Welsh Government funding for the COVID rehab programme for people who'd been to intensive care with COVID, and was kind of, you know, recognised for the work we did with that and the impact it had. And I think what the learning shows is the impact of that rehabilitation for people who've had a critical care stay, not just with COVID, but anybody. And it also is coming through as part of acute respiratory cardiology and how we need to look at our specialist rehab support as people come out of that kind of acute part of their stay and then back home as well into the community. And we really have, through the delivery group, tried to home in on that message, which is we spend all our time and money and staff efforts to save people's lives. Let's really try and make that life worth living through the investment in the later part of the pathway. So hopefully you get that message through reporting from the story today. Huge progress and huge potential for the future, which we'll pick up through our planning processes going forward.
Thank you very much, Nicola. Really, really helpful report and an excellent patient story. And we're very proud that so much progress has been made and would wish to continue the support that's available. Tej?
I have a specific question. I put the comments in the box as to how excellent I think the presentation was and how helpful it was. I'm just asking a question. On page 7 of the report, we have the outcomes from the patient satisfaction survey, which, you know, are excellent. I'm just wondering and reflecting back on that patient story that we had from a couple of years ago that Anne referred to, and the partner of the individual who was a patient, and frankly the trauma that he went through. I'm just wondering if we have any feedback from carers or family aside from the patient themselves.
Steve, do you want to pick that up, or Rebecca maybe, I know, is on the call from a nursing perspective?
Yes, we do undertake patient relative satisfaction surveys and get comments. We tend to put questionnaires into the communal visitors area to get that kind of information back, which has been difficult because obviously visiting is limited. They're coming in, they're being tested, lateral flow tested, and then they come straight into the patient's room, and then they're asked to leave afterwards. So it is a little bit more difficult to get that, but that is part of our plan every year that we obtain relative feedback.
Thank you.
Thank you. Any further questions? Well, thank you very much to the team for this excellent half an hour of showing us. Oh, Sarah.
Sorry, Chair, I was a bit slow. I just and I've just joined, so I hope I'm not repeating something, but I just wanted to record my thanks to the critical care team for all of the recruitment to the various COVID trials and the audit data, because it's been hugely impactful data, not just at the UK level, but at an international level. And we have recruited participants way over our population size to those trials, and importantly we have then implemented the results, and it's just been fantastic to watch us take part in the trials, implement the results, and then refine the learning and contribute to the international learning. And I just thought it was important to record that.
Thank you ever so much, Sarah. That really is important, and I'm glad that you've raised that. Anything further? Well, can I thank you for your time and for your commitment, and keep going.
Yeah.
Thank you.
Thanks.
Thank you.
Thank you.
Right, well, now then, I'm major behind here. I think the agenda has been so interesting, and we have been quite good at asking our questions today, but we will plough on if people are okay. Do you want 5 minutes break? Oh, no, right, okay. The nurse staffing levels, Rhiannon.
Thank you, Chair. So this paper is for assurance, and it relates to the requirements of the Nurse Staffing Levels Wales Act. It's our mandated annual report which outlines the legal duty that we have to calculate nurse staffing levels as part of 25B of the Act. There's a significant amount of work that goes into the management and oversight of the Act to demonstrate our compliance. I know the board are well aware of that. I think that whilst this relates to 25B wards across medicine and surgery, it would be pertinent to just mention the extension of the Act to include paediatrics. I know I covered this off in previous reports to the board, but this is now in force. Just to confirm that we have undertaken a review of paediatric nurse staffing levels. That review was reported to the executive team in September and approved. It's just recognising that the paediatric staffing is not included in this report just because of the reporting period and when the extension to paediatrics came into force, which was just last month. The board will be aware that through previous reporting, we've highlighted that COVID has had quite a significant impact on staffing, but we have been agile and pragmatic in ensuring our compliance with the Act, whilst also noting the dispensations that Welsh Government have given us through the COVID surges. I would just reinforce again how very challenging it has been to monitor wards with the constant repurposing and of course the early opening of the Grange University Hospital. And as a result of the constant repurposing of wards, it has been professional nursing judgment that's been the overriding factor in determining staffing levels, as is completely appropriate. So for the recalculation exercises, 33 wards have come under section 25B definition. The acuity audits have informed our judgment and the recalculation exercise, and we've undertaken acuity auditing formally in both January and June of this year. The board will be aware that we've reported the increase in acuity and dependency, and of course we touched on that as we had the presentation earlier on the winter plan. When there's an increase in dependency and acuity, of course this has an impact on the staffing requirements. Whilst we've had an overall reduction in the number of vacancies, our reliance on bank and agency has still been quite significant. In terms of the 33 wards, 17 have required adjustment to the staffing based on acuity, professional judgment and a review of the key quality indicators. And the report provides the detail in relation to the outcome of those reviews and the associated costs. I just wanted to provide assurance that those adjustments have been through a challenge and support session with myself and the Deputy Director of Nursing with the responsible divisional nurse. And as a result of the collation of all of that, we presented a paper to executive team sharing the results together with our recommendation to approve the revised establishment and indeed convert agency use into substantive staffing, which was fully supported. So this paper shows our compliance to the Act, importantly how the Act enables a robust and evidence-based approach to ensuring that nursing establishments are reviewed and adjusted based on the patient's needs. It also provides assurance regarding the board's duty to make provision for appropriate nurse staffing levels and ensuring sufficient nurses are provided to allow nurses time to care as per section 25 of the duty. Happy to take any questions. Thank you very much, Chair.
Thank you very much, Rhiannon, and we all appreciate how extremely difficult this has been, and we're grateful for the sound professional judgment that's obvious within this ward, given the outcomes for patients. Are there any questions?
Well done.
No? Okay, right, well done. So please feedback that we think you've done extremely well to maintain the services in the situation we've been facing. So thank you. And we've got to remember that we are a number of beds, like 200 beds above our complement, and we've still managed. I mean, it's really quite an achievement. And thanks to all the staff for it. Your acute oncology business case then, please, Nicola.
Thanks, Chair. Yeah, so I'm pleased to present this business case. It's a South East Wales business case, and the report, summary report, kind of sets out what that means for our health board and the opportunity it presents. Just to be clear, acute oncology relates primarily to patients who fall into the groups of either getting diagnosed with cancer through an emergency attendance at one of our emergency department, or patients who are already on a cancer treatment pathway and have got complications or acute issues related to their cancer. So we are talking about a very, sick patient who often attends an emergency department with complications. It's not an insignificant number of patients, over 10 admissions a day, staying on over 8 days on average. So just under around 100 beds for our health board that will be taken up at any one time with acute oncology. The improvement set out in the business case over 3 phases looks to deliver better patient experience, better patient outcomes, and deliver admission avoidance and reduce length of stay through this improved access to specialist support and advice. It's got a lot of strong regional support and endorsement through the Collaborative Commission and Leadership Group, and is reinforced in the Nuffield report that we've received, and is a priority of Welsh Government, reinforced more recently in the Quality Statement for Cancer. The case basically seeks to address some of the fundamental components, which is access to acute oncology nurses, and specifically routine access to acute oncology CNSs and specialist oncologists, expertise at the specialist centre. The business case describes 3 phases. We're looking for the board to support phase 1, which is about building on our current AUS nurse complement to offer a 9 to 5 weekday service across all our 4 sites and enhance that specialist advice that we get from Velindre oncologists. Further work will be required on phase 2 and 3, I think, in terms of our local scrutiny of those cases and the operational detail. And we're trying to put in place a regional governance structure that will enable us to do that. So the board are asked to approve phase 1 business case of 436,000 and endorse progression towards phase 2 and 3. And there is non-recurrent funding available in 21-22 that can cover these costs, but it will be identified then as a priority against our recurrent funding available for 22-23. Thank you.
Thank you, Nicola. Any questions? It is an important development, this, to improve our standards and the safety benefits. So are we happy to accept? Oh, Helen, sorry.
Just come back, very supportive of this initiative. I obviously just wondered, have we seen an increased number of patients presenting through this route? Because obviously delayed presentation of cancer during the pandemic has been a real issue.
Nicola?
Yeah, so I think the recent position around cancer has reinforced the need for this even more. And one of the reasons why we've put this through with the recovery funding is, we are seeing increased late presentation of people with cancer attending our EDs. So I think the case for this has become even stronger since the pandemic.
Yeah.
Yeah, exactly.
I agree. It's certainly a very valuable service and be very supportive of it. Thank you.
Yeah.
Tish?
I just wanted to say that I'm supportive of it. It's obviously the culmination of extensive work and engagement, and yeah, I think it's excellent. Thank you.
Thank you. So are we happy to support this?
Yeah.
For it to be funded this year through the recovery funding? Okay, agreed. Thank you.
Thank you.
Mid-year BAF.
Yeah, yes, Chair. This is the mid-year report for the board assurance framework. You will have the final report at the end of the financial year, ready to go into next year. It's in line with the good governance practice and that we have to employ. And this is the report that went to Audit, Finance and Risk Committee, and to note the changes that have happened during the year. And this report went to the Audit Committee in October. I think in terms of the board, I think the things to note in particular are the revised template that we're now using, which will hopefully provide some metrics to show evidence of change and hopefully improvement, and the change that the mitigations in place have improve things, and where it shows that they don't improve, then we can actually change the mitigation action. Other things to note are that we've started our risk management community of practice, and we've had a couple of meetings with those. Danielle O'Leary has started these up, and they found them very successful, very informative for those who are attending, and it's a major part of the way we're trying to embed the new approach to risk management across the health board. The BAF itself is becoming aligned with the IMTP and the planning process, and that's a deliberate approach to actually make sure that our planning processes identify risks as part of their plans. We've also looking at improving training, and we've undertaken a number of training events, and also looking at the Once for Wales risk management module within Datix. We'll engage on an all Wales basis to actually try and improve the IT and the application that we have for that. The Audit, Finance and Risk Committee have reviewed the internal controls, as I've said, and we're looking at mapping the risks to the risk profiles and improving that throughout the year. This is a little bit of it's not a short path to actually achieve all of this. It is about embedding, and it is about actually trying to improve things and have, I suppose, real risk profiles for the board to actually look at throughout the year. And I think it's important to recognise the depth and the breadth of the work that Danielle's undertaking. It's quite extensive, and she is one person on her own at the moment, and that embedding process will take a long time, but I'm confident that it will improve the way we look at risks throughout the health board. And that's my update. Obviously, the report is in there from the Audit, Finance and Risk Committee, and any questions?
Thank you, and thanks to Danny for all the really hard work and effort that she's put into helping develop this. Are there any questions?
Could I ask about? Sorry, could I just ask?
Paul.
Excellent report, and really grateful to you, Richard, for all your help and support on this. Anything on the outcomes framework? I think we were going to have some. Is there a time frame for that to be discussed, or a meeting or something?
We'll look at that. We'll perhaps the board develop.
Yeah, we're doing.
That's what we can do.
Thank you.
Okay, so we're happy to endorse so far.
Yep.
And note the progress. Thank you.
Thank you.
The finance report, Rob.
Okay. So this report presents the September month 6 performance with the board. We're currently reporting break even for the year-to-date position and for the full year forecast, both revenue and capital. Since drafting the report, month 7 has been prepared and reported on, and break even forecast remains. So just to give you that update. In terms of this report, key points to note: the significant funding confirmed by Welsh Government has obviously reduced the level of risk to our forecasting financial balance, and that was covered earlier, so I won't go into detail on that. Our spending patterns remain consistent with previous months and reflect the service and workforce plans being delivered currently. Savings remain aligned to expectations, and risks include the ongoing uncertainty of responding to the implications of the pandemic. To a degree, those are reducing as we go through the year. In terms of level of spend, particularly on variable pay, and most notably agency, deserves a mention. It's reflective of the current pressures being experienced from urgent care presentations and needing to operate in a COVID safe and compliant environment within our hospitals and services to protect patients and staff. So that's resulting in us using extra beds, additional enhanced care for the case mix of patients we're seeing, and to provide cover for absence either from COVID or from isolating staff. So that's driving the costs that we're seeing at the moment. Within recovery activity, we're continuing to utilise the funding that's been provided by Welsh Government. And we've had a second tranche of that come through recently. So again, that's providing an opportunity non-recurrently to do what we can to escalate and accelerate some care for patients. We're holding minimal discretionary reserves centrally, and they'll be mainly related to the COVID funding we're expecting to be confirmed later in the year as we can progress quarterly with our returns to Welsh Government. They'll be reviewed and be part of the Q4 board delegation request, similar to the paper earlier. I'll mention the underlying financial position again, since it's reflected in the report and is significant. What I will draw your attention to is the Welsh Government funding for an Iron Bevan that's been earmarked for 22-23. A figure of £32 million recurrently has been identified, and that's to support planned and urgent care sustainability into the future. And we need to consider, as part of the IMTP process, how that funding may provide an opportunity to improve the sustainability of previous investment choices. The board's cash position and payments performance is presented, and we've met our public sector payments targets, and the board is asked to receive the report for assurance. Thank you.
Thank you, Rob. Paul?
As I said earlier, I think the fact we're looking at this quarterly and just looking at things and reviewing and monitoring things, I think is incredibly helpful. The fact is, break-even position, I think, is incredibly, I think we've done incredibly well to get to a break-even position for next year. I think we've also got some very encouraging stuff on the horizon with regard to capital programmes, and again, we should be grateful for that. We seem to be getting very, very helpful support from Welsh Government in terms of sustainability funding. And I think, where we are, the position we are, I think we're in a relatively good position, and to thank all the staff, for all their help and support with regard to that. Things are going to get challenging, and I think we've got some to look at creatively and innovatively about how we may have to change some things, how we work, etc. But I think where we are currently, and the report you've given, Rob, I think appears to be very encouraging. Thank you.
Thank you, Paul. Are there any other queries? I just have one. I note that you have a savings target, and a part of the report relates to what's been achieved, but I have to say that I'm a little confounded that we're saving on CHC and FNC when we're trying to send people out to suitable care.
And that's reflective, Anne, really, of the pressures that the organisations are facing as a result of the COVID environment in which they're working within, securing staff to provide services, the implications of having to close rooms and beds when they're effectively getting COVID infections. So that's driving a degree of this. Plus there was potential costs that are being avoided from forecasts not coming to fruition throughout the year as well. So that's how that's driving that position.
But they were identified as savings, and we wouldn't have known the consequences at the beginning of the year.
Well, that's quite correct. These are fortuitous to a degree, and we need to look at how we establish our recurrent savings basis, refreshed really for the future years. Yeah.
Thank you. Tej?
Not so much a question, but just an acknowledgement of a deep challenge. So I note in the report that our locum costs have gone up, and yet in a previous report we were talking about savings and how we'd like to reduce our spend based on engaging permanent staff rather than locums and bank staff and so on. And it just seems that there's disparity there. I know it's an extreme challenge trying to address this, but we need to do some further thinking about how we can reduce those costs in such a challenging environment. It just seems to me to be contradictory that on the one hand the costs are rising in one report, and in another we're identifying that as an area of savings.
And the position that probably isn't clearly presented is we are seeing an improvement in the potential trajectory that would have emerged from our variable pay costs, agency, etc., locums, that would have existed if we weren't taking action. Now, probably our most successful action is to reduce our use of off-contract agency, whilst, you know, admittedly, as you've identified, we've had to maintain our variable pay solutions to keep services safe. So recognise the observation, absolutely spot on. But we are seeing a reduction in our potential costs, and I'll have a think about how that can be presented to the board next time.
As I say, it is acknowledgement of the challenge rather than anything else. Thank you.
Shelley?
Yeah, can I just say, on page 14, Rob, of the report, it talks there about the opportunities within the annual plan for looking at efficiencies and digital solutions as an enabler to service change and financial improvement. And I think that's an area that I don't think as a finance audit committee we've seen anything on in terms of actually what sort of things we're talking about. So perhaps we could add that on to our list of items under the best use of resources, because I'm guessing we're talking about robotics, and I know there was a project on robotics which had funding during COVID, and I'm not sure what happened with that, but, you know, has that been successful? Is it being rolled out? So I think as a board it would be helpful to get a feel on that as an enabler, because at the moment I personally don't feel I've got a particular handle on it.
Sure.
Yep, fine now. Thank you. Any further questions? No, thank you, Rob. Performance, Nicola?
It's nice to present the performance report. It's been a while. I'll just come to the time and draw out some of the few areas, because obviously you will have read the report. So just on elective care, first of all, we've seen a steady increase in elective activity over the last few months now. In terms of absolute numbers, we're treating around 900 patients a week between inpatients and day cases, and I've got no doubt our hospital model with our separation of elective now work at the Gwent and Neville Hall is helping us maintain those levels at the minute. And we were talking earlier about the PACU model at the Royal Gwent, which I think is helping us minimise the amount of elective work that has to happen at the Grange. Our whole prioritisation is on a risk-based approach in line with the Royal College guidelines, and the teams are continuously looking at alternative approaches to traditional outpatients, for example, so that we can try to get through the backlog as much as possible. And there's a big focus as well on validation, given the time delay and the length of time people are waiting, to make sure people are still content to stay on the list and have treatment. We have consistently seen a reduction in the number of people waiting more than 36 weeks in the last 2 months. Still huge numbers. The October figure is now about 36,200, but it has come down from September. And, you know, so we are continuing to make progress, albeit, you know, we see this as a key risk for us in terms of the winter pressures, but are doing what we can while we can. In terms of diagnostic access, similar kind of story, just, you know, big challenges with large backlogs, particularly around endoscopy linked to increasing referrals. So a big focus on endoscopy that's mentioned. But again, we've continued to bring down the numbers of patients waiting 8 weeks, and it comes down by another 400 in October. So, and when you look at diagnostics and RTT at a Wales level, you know, they're all quite a sombering position, but we have got the lowest levels if you adjust for head of population in both of those areas, showing that continued reduction. And I think reflects the hard work the teams have kind of been putting in on that. Urgent care, you know, we've talked about it through the winter plan quite a lot, continues to be under significant pressure. Demand to ED and MIU continue to be high and higher than pre-pandemic levels, particularly self-presenters. Ambulance handovers continues to be a significant concern for us and a key concern, but we did see a slight decrease in the numbers of ambulances waiting for more than 1 hour. And again, as much as there's no positive story around it, you know, the attention we get when you look at October's data for the rest of Wales, we're the only health board that didn't deteriorate compared to last October. We've almost held our position where everyone else has deteriorated. And when you adjust for size of population, we're about second out of the 6 big health boards in terms of numbers of ambulances over 1 hour. So I just think it's important in terms of context and our earlier discussion and the questions Paul raised. 4 and 12-hour performance still need a focus of improvement, and we really are trying to focus on that 12-hour waits. above 12-hour waits in ED to try and get that flow through the system so that we can keep bringing patients into ED and offloading ambulances to take that risk out to the community as well. So all of that forms part of the urgent care plan. So I don't intend to go over that again. Cancer services, our referrals continue to be extremely high, over 3,000 referrals added to our single cancer pathway in September, above our pre-pandemic levels. And you'll see the table on the tumour sites as well, where we've seen big increases in colorectal, breast and lung, which has particularly put in pressure as well on the lower GI as well around endoscopy and diagnostics. Urology is a key concern from a different perspective because we've got big reductions in our referrals, and again is how we make sure the public do present to their GPs, and we try to follow up people who may not be presenting for their regular checkups and so on, particularly around prostate cancer. We have seen a deterioration in our delivery of the 62-day target in September, and that's particularly been affected by delays in the start of the pathway around outpatients and diagnostics and endoscopy, as I just mentioned. So there's a real relentless focus on this to try to improve, and we have come up with some additional opportunities to increase endoscopy around insourcing and additional sessions. Then briefly on stroke, similar position to previous months, still quite poor compliance with our access to the stroke unit within 4 hours, which we're working on, and speech and language therapy as well, in particular, where we do stand out as one of the worst in Wales, albeit nobody's doing particularly well. And we've recently approved through executive team additional speech and language therapy capacity at the Grange, which will help address some of this going forward. And then finally, around mental health, there's quite different sections are highlighted in the report. One or two areas of concern: the CAMS neurodevelopmental pathway dropped to 71% in September, but the team have got a recovery plan in place now to improve on that. And mental health, while doing on the primary care measures, whilst doing well on the assessment, 28-day assessment, have reduced on the intervention side. But there has been a conscious effort, and I think a national approach, where they want people to have that assessment as soon as possible so that we can better assess the risk and make sure we prioritise interventions as much as possible. So there was almost a conscious effort to direct resources into assessments more than interventions at that point. So they were just the areas I would draw out. Obviously there's more in the report and in the dashboard, but happy to pick up questions. Thank you.
Thank you, Nicola. Are there any questions? Comments? I have a couple, if that's all right. And not anything I expect you to respond to immediately. On stroke performance, I really do think we need a longer time to discuss the what might be a successful stroke recovery plan. So if we can ensure that we start to discuss those, and particularly at the planning committee. ADHD school assessments are not one-to-one. I think a note to be circulated on basically what are the benefits in terms of outcomes for that approach. You know, what have we agreed to? Urgent care access we have discussed, and we must come back to that because it's most serious, and I know that we are in a similar position to elsewhere. But I really do think we need to concentrate on the outcome of improving that. And finally, I think that it would be helpful if we could have a note, please, on what is going to happen to the yellow level 4 patients, especially for trauma and orthopaedics and general surgery. What alternatives are being suggested for them? How are they being managed? If that would be all right, please, Nicola. A couple of notes to be attached to the. Thank you. Any further? Paul? You're on mute.
Just to ask about mental health and sort of the quality and impact assessment, really. There seems to be an issue with regard to accommodation, Nicola. Has that been resolved, or are there actions in place?
I know that obviously this psychological therapies has come up in particular around access, and is you know, from the discussions we've had as an exec team with mental health on this, we know there are opportunities around our estate for this. We just need to follow those up in terms of space. So it is something we're looking at through, we'll be picking up through the Agile and through the estates group, albeit we are I know the mental health team trying to deal with the immediate issues.
Right. So and all the issues that are there are being actioned in effect then?
Yeah, I know mental health are working with the teams to try to access space, but I think there is a bigger piece on this, so that we've, because I think we are not using our estate effectively. I've experienced myself community centres and things where we are not maximising that space, and then there's other areas where we are struggling to find space.
Yeah.
But yeah, we are picking that up with mental health.
Thank you very much. Thank you, Anne.
Okay, thank you. Any further queries, questions? I think we all appreciate the struggle that the service is under. Pippa?
Yes, I was just, I started to write something in the chat bar, but I think it's probably easier to express it in terms of with mental health and group therapies, for example. You know, there's obviously a restriction that's being forced upon us by COVID as well. That means bigger spaces, presumably, to gather people together in groups. And I guess I just wanted to kind of highlight, if we're looking at the restrictions that are forced upon us, not just by not using our estate well, but also by outside pressures such as COVID. That was all. Thanks.
Thank you, Pippa. Any further comments? Okay, thank you, Nicola. The executive team report, Glyn.
Yeah, thank you, Chair, and I'm really conscious of time and the fact that we're overrunning. So this report is very much for information for the board. What I've attempted to do here is try and provide a bit of a snapshot of some of the work that is being undertaken by our executive team. It is very much a snapshot, but hopefully you will find it useful. So I've highlighted some of the areas where reviews have been undertaken, particularly with organisations like HEIW, and we will be meeting HEIW in early December as well. I guess the important thing really that I wanted to draw out of this report is the importance of engaging with both our staff and members of the public as we go through the next few months. So you've got some examples in the report of where we're doing that. And I think it's probably important to say that certainly one of my priorities over the next few months is to continue to get out and meet our staff, listen to our staff, and look at ways in which we can provide them with support as we go through what will be a very challenging winter period. So that's probably all I really wanted to say. There's more in the report, but given time, I'll probably leave it at that if that's okay. Thanks, Chair.
Thank you very much, Glyn. Are there any questions or comments to Glyn on his report? Paul?
Just to say, it's incredibly helpful, Glyn, to have just an idea of some other things that are going on about celebrating people winning awards, looking at where we are on current situations. I mean, the roadshow stuff, I think, and going out to boroughs, it's quite useful to get, good background information about what's going on, and to your report that we received for, I think was on members of the Senate, etc. Again, that was incredibly helpful. So as much of the information that we can get to read up on is really helpful. So thank you for providing it, and also an opportunity to say to you and the team, huge thanks for all the hard work at this very difficult time.
No, thank you, Paul. Thank you for the feedback.
Thank you. And could I, on behalf of the board, offer our congratulations to the Royal College of Nursing winners and runner-ups, and it would be helpful for the record if we could have Ms. Hook's first name, which seems to have been omitted, unfortunately. Thank you. Thanks very much, Glyn. The key matters from committees. QPS? Anything?
I don't think there was anything additional to the report, but I'm happy to answer questions.
Thank you. Are there any questions to Pippa? Might I just have a note, do you think, please, on safeguarding and what happens if staff aren't complying? How do we help them to gain Possibly Sarah, if you could. Thank you. Okay. People and culture, that's you.
Exactly the same. Obviously, there's a note on what we covered in the meeting. Yeah. Very happy to answer questions.
Any questions? Have you got a legacy hand there, Paul? Sorry, okay. Planning? Any issues? Okay. Other committees? No? Fine.
Sorry, you missed out audit.
Yes.
As in, you missed my audit committee out, that was all. So I don't know if anybody got any questions on our assurance committee. I've got nothing else to raise on it.
Okay, thank you for that. Any closing matters? If not, then to note that the date and time of the next meeting will be Wednesday the 22nd of January at 9:30. I do hope I managed to chair it to time next time, or something like time, and I'm sorry for the fact that I've detained you for longer than expected. We will have 10 minutes break and then engage in the confidential agenda, if that's okay. You happy to do that?
Yeah.
Yeah. Okay, thank you.
Thank you.